So, welcome everyone to this session. Today we will explore together component network meta-analysis. At first, we will see the transition from pairwise to network meta-analysis, and then we will discuss about complex interventions and component network meta-analysis. So let's start, and let's assume that we want to compare two groups of interventions, for example, for a certain outcome that is weight loss. So we want to compare intervention A and B, and we are interested in finding which of the two interventions is more effective or more safe for the outcome we are interested in. So if we search the literature, we will find a lot of single independent studies comparing these two interventions. So in such cases, we have a plethora of clinical trials which may have contradictory results. Some of them may say that intervention A is better, some of them may say that B is better, some of them may say that there's no difference. So we need to quantify all this information and draw a conclusion based on all this evidence. So how are we going to do that? The solution to such situations comes through meta-analysis. So meta-analysis offers the statistical framework, to contrast and combine results from different studies. All these studies, however, should address the same research question. So what we gain is that we combine multiple sources of evidence, and therefore we have increased precision, and we can resolve uncertainty when studies have contradictory results, as we discussed earlier. So now suppose that for weight loss, we have studies comparing these two interventions, and we conducted a meta-analysis to summarize the information that studies provided, and we obtained a pooled effect estimate. But if we search the literature, we will find that there may be more interventions compared in many studies for the same outcome. So now we have a network of evidence. So this is a network plot. A network plot consists of nodes and edges. Each node corresponds to the different interventions that are included in the studies, in the included studies. So two interventions are connected with an edge when there is at least one study comparing them. So network meta-analysis is an extension of pairwise meta-analysis, and we can use it to compare multiple interventions within a single analysis. A main concept of network meta-analysis are the indirect comparisons. So if two interventions, these two, for example, are connected with an edge, this means that there is direct information for this. There is direct evidence. These two interventions have been directly compared in a head-to-head trial. However, we can compare these interventions indirectly through usual care, for example, which is this node. So we can follow an indirect path and obtain also indirect evidence. So now we have two sources of evidence, direct and indirect evidence. And since we combine two sources of evidence, we gain increased precision for our effect estimates. Also, based on these indirect comparisons, we can compare interventions that have never been compared before in head-to-head trials. For example, these two interventions can be compared indirectly, but there is no study including both of them. Also, network meta-analysis allows us to rank intervention based on the efficacy or their safety. So now, if you look closer at this network, you will notice that all interventions are combinations of 5 different components, which are namely A to E. So such interventions are called multi-component or complex interventions. And let's talk a little bit more about this. So in general, we call an intervention complex when it consists of several components which may be interacting. So what are all these components? These components are considered to be parts of the intervention. So they may be intervention characteristics that impact on the intervention's effect. For example, these characteristics may refer to properties of the intervention. So they may answer the question, what is the intervention? Or how it is provided. They may refer to the mode of delivery. Is the intervention provided, for example, face-to-face? Is it provided delivered remotely, individually, in groups? Or what is its density? How often, for example, the intervention is provided? Is it twice a week? Is it every day? Is it a high intensity or low intensity? Then such characteristics may refer to who provides the intervention. Who is the provider? Is it a doctor, a nurse, a nutritionist, for example, or where the intervention is provided, at which setting? That could be hospital or home. All these are different characteristics that can be part of the intervention. Some examples of complex interventions can be found in psychological, behavioral, and self-management interventions. For example, let's assume that for reducing weight in patients with obesity, we have this intervention, which is educating patients about the disease, and the intervention focuses also on changing behavioral patterns, for example, taking up exercise. So this is a multi-component intervention in terms that it consists of two different parts. The first part, the first component, is about education, and the second part is about behavior. So these are two different components. For another example, in falls and fractures, suppose that we are interested in reducing falls and fractures, and such an intervention may include exercise, medication, and environmental assessment and modifications. So these are three different components. Medication could include some vitamins, vitamin D, for example, and environmental assessment could include things like improving the lighting in rooms or use some non-slippery surfaces. Also, any combination of drugs can be considered also as a multi-component intervention. Now that we've seen components and we got familiarized with multi-components interventions, let's explore component network meta-analysis. So this is the same network as we saw before, but we will see that from two different aspects, from the NMA and the CNMA aspect, the component network meta-analysis. In standard network meta-analysis, we are interested in answering the question, which interventions work? So each of the nodes, each combination of components is considered to be a different intervention, and we were going to estimate a different effect for each of them. So each different intervention here is denoted with a different color. However, in component network meta-analysis, we are interested in which components work. So we treat the interventions as combinations of these 5 different components, which are denoted in different colors. So in the component network meta-analysis, the interventions share the same components, while in network meta-analysis, all these combinations are considered to be distinct interventions. So in network meta-analysis, how we would analyze this network? First of all, this subnetwork cannot be analyzed as it is not connected to the rest of the interventions. So we cannot take this information, these studies comparing these two interventions cannot be considered in the analysis. So we have 9 different interventions here, plus the reference, which is the UC, the usual care. And through the network meta-analysis framework, we are going to estimate 9 different effects for each of the interventions. In component network meta-analysis, the whole idea lies in the decomposition of the multi-components interventions. So as I said before, we are interested in which components work. So we first estimate the effect of the component, of each of the components versus the reference, that is the same here. And we use these effects to calculate the effects of interventions by summing the components' effect. For example, the effect of A plus B plus C of this intervention is equal to the effect of component A, that was calculated over here, plus the effect of component B plus the effect of component E. So now notice that this network, while it was considered disconnected in network meta-analysis, now it is considered connected because these interventions share the same components, so it is considered to be connected in a way. So let's see the differences to have a better understanding. So network meta-analysis focuses on which interventions work. It can be applied only to connected networks, and we can compare, as we said before, any pair of interventions, even if these interventions have not been directly compared in head-to-head trials. We have two sources of evidence, direct and indirect evidence, and this is the reason we have increased precision in our effect estimates, and we also have some ranking options. In component network meta-analysis, we can analyze also both connected and disconnected networks. Again, we have the benefits of network meta-analysis, but we also have more evidence, which leads to more precise intervention effects and more moderate effects. Let me explain. So this happens because network meta-analysis estimates the effects of intervention using the results of studies that include a specific intervention examined. Component network meta-analysis, on the other hand, uses the results of all studies that share the same component. So in network meta-analysis, the effect estimates may be informed by only some studies that include the specific intervention. That could be maybe a single study or very few studies. However, in component network meta-analysis, this is not the case because results are not based on individual studies, and therefore they gain information from all studies that include interventions with specific components, and therefore we may have more moderate effects. So in component network meta-analysis, we have two models, the additive model and the interaction model. The additive model assumes that there is no interaction between the components that are included in the intervention. So we use this formula to estimate the effect. For example, the effect of A plus C is equal to the effect of component A and the effect of component C. However, assuming no interaction between components is a strong assumption to make, because some components may interact synergistically and thus they may lead to larger effects, while some others may interact antagonistically and leading to smaller effects. So to capture, for example, here in this example, where we estimate the effect of A plus C, we assume that these two components interact with each other. And to capture this interaction, we include the interaction term, which is that one. So if these two components interact antagonistically, this means that their effect, when combined, will be smaller than their separate effects. While if these two components interact synergistically, this means that their interaction term will be positive, and their effect when combined will be larger than their separate effects combined. So keep in mind, however, that defining that these interaction terms, it's not an easy process. And interaction terms may be large and we may not have much data to inform all this. So what we need to do, what is better to do, is to carefully consider the interaction terms, even at the protocol stage of the analysis, and use any clinical information that could inform us about their interaction and potential interaction. And of course, this requires very good knowledge and classification of components at the very beginning. So another common issue in networks of multi-component interventions is that they are sparse. What that means? It means that most of the included studies compare an intervention to a reference, for example, usual care in this example, and there are only very few studies that compare interventions with each other. We can see that in this example. Interventions are mostly compared to usual care, but they are not edges connecting them, only a few, so this means that they are not directly compared in head-to-head trials. So in such cases, the efficacy of interventions may be confounded with study characteristics. So all the information in network meta-analysis informing the effect estimates may come from a single study or very few specific studies that include the intervention. So let's see an example to make that clear in this fictional example. So let's assume that in this comparison, A plus C versus UC versus usual care, we have only one study. And this study provides a very large effect. So when we conduct a network meta-analysis, the effect estimates that we will obtain will be based on this study. So if we have a large effect, then the treatment effect, based on the study, the treatment effect that we will obtain for this comparison will be large. But we don't know if this treatment will be considered very efficacious. But we don't know if the efficacy observed is due to study characteristics or the intervention itself. So this intervention, for example, may have been given in this study in patients, in population that acted very well, reacted very well to this intervention. For example, they may be very young and the intervention works very well on them. Or maybe this intervention was given at very high intensity at this trial, and this is the reason we observe large effects. But finally, we don't know if the efficacy observed is due to these study characteristics. So we have a confounding issue or it's the intervention itself. It's difficult to say. So let's see now a real data example. So in this example, the authors explored single, multiple, and multifactorial interventions and their individual components. And the outcome they explored and we are interested in is preventing fall-related fractures. So the authors performed both network and additive CNMA model. And let's see some details about this network, about the specific outcomes. There were 46 studies included, exploring 27 interventions, and there were 14 components, plus the usual care. So this is the network. As you can see, the pattern that we discussed earlier is obvious. So most of the interventions are compared to usual care or to placebo. There are 2 placebos in this network. And there are very few studies or no studies at all comparing the interventions with each other. So these are the results. In this table, we can see the component effects on the log risk ratio and on the risk ratio scale. And by applying the CNMA, the additive CNMA model, we have obtained the effects of each component separately. So we can use these component effects to calculate the effect of any combination, even if this combination has not been observed in the included studies. For example, the effect of the combination, if we combined assistive technology, environmental assessments, and quality improvement strategies and psychological interventions, we can find this effect by adding the effects of each component separately. So the effect of assistive technology on the log risk ratio scale is 0.51, 0.17 for environmental assessment, minus 0.31 for both psychological and quality improvement strategies. So we obtain the summary effect estimate for comparing this intervention to usual care, that is 0.06. So based on this, but can you estimate the effects of the assistive technology and basic false risk assessments? There will be a poll where you can choose the right question, the right answer to the question. Okay, so most of you found the right answer. That is D, 0.38. And how we found that is we can find this by summing up the effects of assistive technology and basic fall risk assessment. So intervention in this table, we can see the results of network meta-analysis and component network meta-analysis intervention effects for 7 of the interventions that had the largest effects according to the network meta-analysis. So overall, we can see that component network meta-analysis provides more precise and conservative effect estimates. So the largest effect in network meta-analysis was that one, the first, for quality and risk. And you can see that this is very obvious because when a component network meta-analysis is applied, then we have more moderate effect and more precise effect. We have more narrow confidence intervals. So if you notice closer, if you notice the data, you will find that this combination was compared in only one study. So it is possible that confounding is present here. And the large effect that we observe here in network meta-analysis is due to study characteristics reflects the study characteristics rather than the intervention itself. But keep in mind that confounding may also be present in component network meta-analysis if components are observed in only a few times or in only a few arms. So this is the case for the component social, and that is why, if you go in previous slides, social, it has a very large effect estimate compared to the rest, and it is accompanied by a large confidence interval. So I forgot to mention earlier that under the additive component network meta-analysis model, where we assume that the effects of its combination of components equals to the sum of the effects of individual components, this is called the additivity assumption. And the additivity assumption is a main assumption in component network meta-analysis, and we can test it. There are some tests to test them, but only for connected networks. So additivity assumption should hold to have valid results, and if biased, we may have also biased results, biased effect estimates. So in this example, additivity assumption based on the test holds and supports the use of additive model, but keep in mind that this is like the heterogeneity tests. The additivity assumption holds, but as in heterogeneity, a negative test for heterogeneity is not proof that heterogeneity is not there. So we have to be very careful with this assumption. So overall, with component network meta-analysis, we gain more precise intervention effects as we use evidence from all studies that serve the same components. We also get more moderate effects because the effect estimates that we have are not driven mainly by individual studies, but they take into consideration all the information from studies comparing and interventions sharing the same components. The estimation of the effect of all combinations of components is possible, even if not observed in included studies. So we can estimate the effect of any possible combinations that we can think. But again, caution is needed here because we have to keep the clinical aspects. Some of the combinations may not be feasible or may not have any clinical value. Also, with component network meta-analysis, we may reduce confounding in sparse network, but transitivity assumption, which is a main assumption in network meta-analysis, and implies that all the indirect comparisons are valid, may still be threatened. So we may reduce confounding in sparse networks using component network meta-analysis, but we should again consider transitivity. The additivity assumption that the CNMA uses is a strong assumption to make, but when we have to be very careful because when this does not hold, we may have biased estimates. There is a statistical test to test for the additivity assumption, but this is only valid for connected networks, so it cannot be applied to the disconnected networks that we saw earlier. The interaction model that we saw before assumes that components may interact with each other either synergistically or antagonistically, relaxes this additivity assumption, but still it is very challenging to define the interaction terms. And we need to do that a priori, even at protocol stage. And as I said before, it requires very good knowledge of the components included in the studies. The consistency assumption, which is the statistical manifestation of transitivity in network meta-analysis and is a main assumption, cannot be assessed in component network meta-analysis. And we cannot also test for small study effects using the methods that have been proposed in classical network meta-analysis. But we can do that we can do that in network meta-analysis. So then presenting results is also very important. Results, the effects of both interventions and components can be presented using forest plots or using tables, as we saw earlier. And also, as authors of this Cochrane review, which explores pharmacological and electronic cigarette interventions for smoking cessation in adults, as they have done, summary findings tables can be adapted like this, where each row corresponds to a different component. So the tables can be adapted to better suit the component network meta-analysis concept. So how and when to apply component network meta-analysis? You should consider applying component network meta-analysis where your network includes multi-component interventions. You can do that within both Bayesian and frequentist framework. Especially in frequentist framework, there are some R packages included in the NetMeta R package. More specifically, there are some commands which you can use and very easily conduct a component network meta-analysis, both in connected and disconnected networks. You should not choose, there is no answer to which model is better. These models are complementary. So it's not to choose network meta-analysis or component network meta-analysis when we have networks of multi-component interventions. A middle way, or a better way, would be to estimate, to perform network meta-analysis, get the network meta-analysis effects, and then explore which components are observed in the most efficacious interventions, as these were indicated by network meta-analysis. Also, there are some visualization tools which are based on network meta-analysis and can give insights on how components are combined, for example, or on the frequency of components in a network meta-analysis, in a network of multi-component interventions. So very briefly, let's see a graph that is offered through this package, the VSCOP package. This is called components cross table, and it describes the number of farms that include a component or any pair of the components. So in the diagonal elements refer to components, and the off-diagonal elements refer to the components combination. So we use the density of color that is set proportional to the relative frequency of the corresponding component. So for example, component A is included in around 35% of total study arms, and the total study arms are indicated down here. And based on the density of the colors, we can see that component E is almost always included in the interventions. And the same we could say for component F or component B. But we can see that component D is not combined with any of the components, and it appears only alone in interventions. So these are some. These tools can be used to explore the frequency of the components included in the interventions and give some insights on the network. So these are references and resources.